Emergency drills, shoulder dystocia, postpartum hemorrhage, and neonatal resuscitation. Water birth is a safe, low-intervention option for well-screened individuals, but unexpected complications can occur. Emergency drills are vital in both home and facility settings. Regular simulation trainings help birth teams build the skills, coordination, and competence needed for quick, effective response. Key emergencies to prepare for include shoulder dystocia, postpartum hemorrhage, and neonatal resuscitation, each requiring clear roles, protocols, and aquatic-specific strategies to ensure safety. Shoulder dystocia is when the shoulders fail to deliver after the head is out, often due to impaction behind the pubic bone. Though rare, it's an emergency that can cause serious complications if not resolved quickly. Water birth considerations, you want to look for the turtle sign. You want to look for the head retracting back inside. You want to look and really distinguish between a true dystocia and a normal pause with normal restitution, because normal physiological birth, the head and the shoulders don't deliver all at once in one contraction. You usually have the head delivering, and then you have a pause until the next contraction for the shoulders. So what I typically would do is after the delivery is I would gently take my hand and I would just feel the baby's neck. Is it tight? Is there a cord present? If it's loose and relaxed and the baby's wiggling the head, the baby is fine. If the baby's cheeks are really squeezed and tight, and if I have a light and I'm visualizing the baby and the baby looks very purple, and is very compressed at the perineum, then we're going to do some repositioning and not wait for the next contraction. You want to do some emergency drills that stimulate and simulate recognizing the turtle sign. You want to practice coordinated roll-based exit from the tub. You want to rehearse McRoberts, Gaskin maneuver, and suprapubic pressure. The really nice thing is most shoulder dystocias, as soon as you do the big hip exaggeration and the positions to change the angle of the pelvis by getting out of the tub and doing that first maneuver, it's extremely rare for you to not have to do anything more to resolve the shoulder dystocia. Ensure clear time tracking and that someone is documenting the emergency escalation steps that. When you have a postpartum hemorrhage, it's a little bit harder to be able to tell how much is in the water. You have to have the skills. It's diluted, it's slow to pull out, it's harder to detect. So my rule of thumb, the mom's usually not moving around much. The water is calm. I'm watching around her vagina, how much blood, how far it's spreading out. If I have it spreading out at least a foot from her perineum within a minute and I can't see the bottom of the tub, I know it's concentrated and I know it's a higher amount of blood flow, and I'm usually encouraging the delivery of the placenta, getting them out of the water. If it's just a pink tinge and it's barely any and it's slowly occurring, that could have been from a tear. It could have been just from the birth trauma itself. So there is definitely an art to keeping an eye on the perineum, because they aren't moving a bunch. It's going to stay in a concentrated area, and watching the trend happening. If you have a postpartum hemorrhage, you get them out of the water, you stop the delayed cord clamping, you do fundal massage, you give them medications, you assist with the delivery of the placenta. Your emergency drills should give both options to simulate delayed third stage, the rising blood flow, when to get them out of the tub, when they're not feeling symptoms, when they are feeling symptoms. Rehearsing, typically at a hospital, practices aren't going to have an IV site, so you're typically going to give IM Pitocin. In a hospital setting, they probably have an IV site, and you can do IV Pitocin. You could give misoprostol rectally or orally. You want to activate emergency transports if it's an out-of-hospital birth so that you can get the additional resources from the hospital. When we're talking about neonatal resuscitation and water births, our goal is to Sometimes you're able to do basic resuscitation in the water while the mom's holding the baby, especially home births, and keeping the cord intact because you have far less staff and your highest priority is getting the baby's lungs to open. You don't have a lot of people that one person can focus on cutting the cord, one person can focus on helping get the mom out of the tub, another person can focus on the baby, another person can focus on the mom. You usually only have the midwife and the birth assistant in the home setting, so you have to prioritize things. And many times all you need is just a couple puffs of the ambu bag to get the baby to transition and breathe. But I always stress to people, out of hospital births, water births, they're more gentle. The baby's APGARs are going to be slightly less because the time the baby was delivered was at the perineum. The time it took its first breath was when it was out of the water. And so as long as they're looking around, they've got good muscle tone, you're getting a heart rate above 100, give patience for the baby. The baby doesn't know it's out yet. It's getting good oxygen from the cord. So we have to be patient with physiologic birth. It's not that we have a high risk pregnancy and we have a stressed out baby and we have complications we have to immediately address. We have to look at physiological birth differently than we do high risk medical births. You want to gently bring the baby to the surface with the head emerging before the chest to avoid accidental water reflux. If the baby isn't having good muscle tone, the heart rate is below 100, and you, as a midwife, your skills, I mean, you can feel that baby as it's coming out. Is it wiggling? Is it strong? Is it floppy? Is it limp? You're already knowing and anticipating as you're bringing the baby out of the water, are you going to need to help this kiddo out, or can you just be patient with time? So you want to do some emergency drills. You want to practice normal, healthy newborn transition, and you want to practice newborn resuscitation and unexpected occult cords, placenta abruptions, non-reassuring heart tones at the end. You want to practice dry resuscitation. You want to practice bringing the resuscitation equipment near the tub if you can. If you're in the hospital setting, you're going to have to clamp and cut and bring the baby to the warmer for the resuscitation. But in birth centers and home births, they have a little bit more mobility with their resuscitation equipment. You want clear roles for everyone. You want people assessing, assisting, documenting. You want at least 2 people at the births at all times that align with NRP certification standards. Best practices for emergency drill implementation, it needs to be an interdisciplinary simulation. You need to have nurses, obstetricians, midwives, EMT, birth assistants, pediatricians, ER providers, whoever is going to be, you had a water birth, and who may be involved in that care based on the setting. You want high fidelity mannequins, you want volunteers, you want real life, you want great actors, you want to simulate the best you can the situation that's occurring. You want role assignments, you want to define leads, support staff, documenters, communication roles. You want to debrief the session. You want to talk about the timing, the communication, the strengths, the weaknesses. Your frequency of your drills is so important. We can't just do it once a year. We need to be doing it quarterly, monthly, rotating skills and drills in all aspects. The more you do something, the easier it becomes an instinct, and everybody else feels comfortable and more calm during those emergencies. Emergency preparedness in water birth is a professional duty. Training for complications like shoulder dystocia, postpartum hemorrhage, and newborn resuscitation enables swift, safe, coordinated responses. Drills should reflect the unique challenges of water settings, focusing on smooth transitions, clear roles, and proper tools. Well-prepared teams can uphold the benefits of water birth while staying ready for emergencies.